Dr. John, welcome to the Easy Conversations podcast. Thank you for joining me today. This is an area that is close to me because I have a immediate family member who's dealing with cancer, and I'm working with a lot of people personally who are struggling with this. And there is a lot of new information that's coming forward around how some of our choices, our behaviors, our thoughts, our emotions can impact the diagnosis of cancer. So I'm looking forward to covering some of those areas with you as well and getting a deeper understanding of how we can change our perspective when it comes to this illness or disease. But before we start, I do want to give you an opportunity to share with the listeners a little bit about yourself, what's brought you here, what you're doing. Yeah.
Yes. And first of all, I thank you and I thank our listeners and viewers for giving me this opportunity to express my views on the subjects of food intake, obesity, cancer, and type 2 diabetes, especially. That is one of my areas that I'm very much interested. If we have time, I can tell you that many people, they believe in the present concept, which is called insulin resistance.
Mhm.
Just to ask a simple question off bat, have you ever heard of a test to measure insulin resistance?
No, I haven't heard of one.
Why? Because the insulin resistance is an explanation to get ahead of us.
Yeah,
If that is interesting to you, we can proceed with that one or whatever
sure.
you
Yeah.
want to choose.
Yeah, I just want to ground the listeners. I do want to also give you an opportunity to talk about your background a little bit
Oh,
and
okay. Yeah.
what field of work you're in. Yeah.
Yes, I can do that.
Yeah.
Sorry for the digression
Oh
there.
no, I can tell you're passionate, so it's all good.
Okay. I grew up in India,
Hmm.
did my medical training in India, went to Scotland for a year of an internship, came to the United States in the year 1970, did my residency and fellowship, started practicing. And that is when I noticed changes, weight gain, type 2 diabetes, cancer, increasing incidence.
Hmm.
So I started asking the question, why?
Hmm.
The first thing is everything starts with weight gain.
Hmm.
You cannot gain weight unless you eat,
Hmm.
right? So, what is the now? Let me ask you this question.
Hmm.
Can you predict when you are going to feel hungry next?
I don't think so. No.
Okay, nobody can precisely. But how does the brain create? What forces the brain to create the sensation of hunger? What is the underlying physiological mechanism? Can you say something?
I'm assuming this is just a guess. It would have to do something with glucose or
That is the conventional phenomenon. When your blood glucose level goes down, you feel hungry,
yeah.
which you do. If that is the case, if the primary reason, a diabetic should never feel hungry.
Hmm.
You take then the experts will say, oh, their metabolism is deranged. That's why they are diabetic. You cannot trust that.
Hmm.
Okay, you take a non diabetic, give him IV glucose, keep his blood sugar high, he will still get hungry. So, that is question number one. I could not find answers in medical textbooks. The second question was, do you eat the same volume of food each time to feel satisfied?
No.
So, what is the mechanism that tells you you had enough?
I think personally, I think we're not eating consciously, so we're not even aware of how much we're consuming, right? So
Right?
I think there's an aspect of emotions involved, but that's just my view.
Take a child.
Yeah.
So, these emotion, that could not be the factor. There has to be a physiological reason.
Hmm.
A baby will drink 2 ounces of milk one time, next time will drink 8 or 12 before satisfied. So if the baby has the capacity to drink 12, how can the baby be satisfied with two or three? Second question, so I could not find answers to that either.
Mm.
The third is, if you take, let's say, what time did you have supper last night?
Around 8.
8.
Yeah.
May I ask, what did you eat?
Yeah, we had tacos.
Tacos with what? Meat or
Oh, yeah, with fish.
fish? Okay. Then in about 4 hours, by 12 o'clock, all that has been digested and absorbed, the taco shell will be absorbed as glucose.
Hmm.
The meat will be absorbed as cholesterol and fatty acids, and all the proteins will be absorbed as amino acids.
Hmm.
And when the blood sugar level goes up, the pancreas releases insulin. And so glucose, amino acids, fatty acid, cholesterol, and insulin goes into the blood to and through the blood to every cell in the body,
Hmm.
30 plus trillion of them.
Hmm.
And it is insulin that rings the bell of each cell. Each cell is an independent living unit. Now, let us say you live in a house or an apartment. How do you know there is somebody outside to see you? They ring the doorbell or
Yeah,
they
if
knock
they're
on the
there to
door.
see me, yeah, absolutely.
Every cell in the body can use glucose to produce energy,
Hmm.
but glucose cannot ring the doorbell.
Hmm.
It is insulin that informs the cell glucose is outside. Then the cell has the option, just like you do, whether to open the door or not.
Hmm.
If the cell needs glucose, it will send a wagon to the door, load up glucose, and bring it in. Okay?
Yeah.
Cell is resisting insulin. Okay? To me, that is not the case. Why? Because the cell is still functional. Suppose there are an apartment complex with 200 different apartments. One day, three of them independently decide, oh, we are not going to respond to the mailman from tomorrow. How is that possible? Who is coordinating this?
Hmm. Yeah, I may try some.
You may try some,
Yeah.
or later on, if you don't eat it at that time, you get so full, you will eat it later and enjoy it.
Hmm.
The cell is doing the same thing. The cell is already functional.
Mm.
It is producing energy. It doesn't need glucose. But later on, the same cell will accept the glucose.
Mm.
But endocrinologists want to insist and force the cell to accept it
Mm.
because they say the cell is resisting.
Mm.
So that is the concept of insulin resistance and type 2 diabetes.
Mm.
So my views on the subject of what causes the hunger sensation, what causes the satiation, and what causes type 2 diabetes are explained in my first book, Eat, Chew, Live. It should not be even classified as a hormonal disease under endocrinology. They have nothing to do with, but they keep the patients because as it's a good source of income.
Yeah. Yeah.
And they are supported by pharmaceutical company monitoring devices.
Hmm.
So if you are a patient of type 2 diabetes taking insulin,
Hmm.
by the way, if you are resistant to an antibiotic, will the doctor give you the same antibiotic? What do they give you? Insulin.
Yeah.
How can you justify that?
Hmm.
So if you are a type 2 diabetic, especially if you have any complications such as kidney damage, 50% of the people, even with insulin, will have kidney damage.
Mm.
You have every right to demand satisfaction. And I'm hoping the people who are suffering will join together because individually they are afraid. But if they join together as a class, they should demand an explanation.
Mm.
Otherwise, it will keep on marching. There are 500 million people around the world suffering from type 2 diabetes.
Hmm. Yeah.
How many kidneys are going to be damaged? How many eyesights are going to be lost? How many hearts are going to be affected? How
Mhm.
many brains? How many people will develop Alzheimer's?
Yeah.
Because the treatment, in my opinion, is not the right one. Don't get me wrong. If you're a type 1 diabetic, you need insulin to survive.
Mhm.
But for type 2, that is not the right medicine.
Mhm. Mhm. No, and I appreciate that. So, a lot of questions based on what you've shared here. So, is it fair to say that cancer, obesity, type 2 diabetes, some of the things you've talked about that are really chronic, there is an overlapping cause here with respect.
Yes, that's an excellent question.
Mhm. Sure.
Medical examination. They practically had no type 2 diabetes, very few cardiovascular diseases, and practically no cancer. The Royal College sent an expert team of doctors to analyze their, the conditions, and they could not specifically find a reason why the Native Americans don't have cancers.
Mm.
So they claimed that Native Americans are immune to cancer. Okay. Now, the incidence of cancer in the reservations is higher than the white population outside. Type 2 diabetic incidence the same.
Yeah.
Obesity, heart attack. Why? Think about it. What did Native Americans eat during their natural habitat? They moved from one food source to another. They ate meat, fish, eggs,
Mm.
vegetables, nuts, fruits, yams,
Mm.
but they did not eat one thing. Can you think about it?
Well, if I was to guess based on what you've talked shared there, sugar,
They did not eat any cultivated grains.
cultivating. Okay.
They did not stay in one place to plant grains or cultivate. So they did not eat any food made from wheat, rice, or cultivated corn. They did eat wild corn. Other one. So, but what did they get in the reservations?
Yeah.
Plenty of food made from grains and grain flour. So the result is they have high incidence of obesity, diabetes, and cancer.
Mm.
Now, which direction do you want to go now?
Yeah, no, I appreciate that. So, yeah, I want to go a few directions, but let's see here. I want to make sure we're very structural here. So, cultivated grains, and I've read some of our history, but the agricultural revolution really made it easily accessible for us to have these grains, and it's obviously cheaper to manufacture. So, that's become a huge issue. Now, you've talked about your kind of move to the United States where we hear about a lot of these issues that we've talked about. So obviously, where we're taking this is with diet. So what? So you've touched on the cultivated grain, but the diet in general is a contributing factor. Is that a fair conclusion?
Yes, that is the factor, the
Mhm.
most important factor. Now, as far as the cultivated grain being cheaper, there
Mhm.
are two. The primary aspect is the government subsidy.
Mhm.
Every government in the world subsidizes, almost every government, agricultural farming either through direct subsidy to the farmer,
Mhm.
fertilizer subsidy, or ration cards for the consumer to get it cheaper. And the sad truth is, the poorest people are affected the most
Mhm.
because the cheapest food available
Yes.
are grain based.
Mhm.
When is the last time you had a meal or a snack without a grain based item?
Yeah, it's hard for me. I try to pay attention to that because I know they're easily accessible in everything, but there's an aspect of our gut microbiome too that gets impacted by these grains, and I don't think we fully appreciate the impact it has on our gut.
Say that again.
The gut microbiome also gets impacted significantly based on some of the research I've come across with respect to the grains like rice, pastas. And
Yes,
yeah,
they are not the original microbiome was not designed
yeah,
to deal with so much complex carbohydrates from coming from grains.
hmm,
All you have to do is look at grains were never meant for humans.
hmm,
Otherwise, we would have had beaks to pick them up and the ability to digest the chaff.
hmm,
You don't. So it is not a natural food source or energy source for humans.
yeah,
But because the government wants to feed large number of people, they subsidize grain farming. And as you correctly suggested, the agricultural revolution, followed by the industrial revolution that made milling and refining and packaging
hmm,
easier,
yes,
have led us to this state.
hmm,
If we don't do something, the next epidemic is going or pandemic is going to be dementia and Alzheimer's
hmm.
and cancer, of course.
Yeah. So, how do you tie in dementia and Alzheimer's, right? Because those are memory related, but yeah, how do you draw that conclusion based on diet?
Okay. Uh, Alzheimer's is part of dementia,
Hmm,
but in people who have type 2 diabetes.
hmm.
Dementia, do you know the how dementia is diagnosed? You take a scan and your brain shrinks, and that means dementia. If you also have diabetes, you have got Alzheimer's. That's the difference. So each one there are, in other words, there are some people with dementia without Alzheimer's. So to me, both of them have different reasons, but they are also connected with the modern day diet. So which one do you want me to discuss first, Alzheimer's or dementia?
Yeah, let's start with dementia.
Dementia.
Hmm,
Dementia is shrinkage. Now, if you put something outside a vegetable and draw the water out of the vegetable, what will happen to the vegetable?
same thing. It'll shrink.
It will shrink.
Yeah.
It is what is called pickling.
Hmm.
Okay? And what is the agent that draws water out of the vegetable? What's the most common agent that we use?
I'm dry.
Salt,
Salt, right? Yeah.
right? If you take some cucumbers,
Yes.
put mix some with salt and not the others, you can see the water coming out. The cucumber volume will go down. Imagine the same thing happening in your brain. You have so much salt in the cerebrospinal fluid. Your nerve cells lose water. The whole thing shrinks. Just about 100 years ago, the average intake of salt in our diet was less than 1000 milligram. Now, in the developed countries, it is 3500 and above. There you are talking about per day.
Yeah.
Why? Because all you have to do is look at complex carbohydrate from grains and foods made with them. Take a piece of bread. How much salt is in it? Anytime you have a processed foods, in order to keep the shelf life longer, they add salt.
Yep. Yeah.
In order to produce taste, they add salt. And the sad thing is, the body wants to keep the salinity of the blood and the fluid very within a very firm range. So if the salinity of your saliva is higher, in order to know the food you're taking is salty, that saltiness of the food, salt content of that food has to be higher than your own salinity of your saliva. So gradually you end up eating We are attracted to foods which are higher and higher in salt content.
Mm-hmm.
All you have to do is go to a bus station, railway station, airport. You can see children running around with packaged chips
Mm-hmm.
and snacks full of salt. So consuming the same thing every day, multiple times a day. What is the salt induced problem they are going to have? So, so much salt,
Mm-hmm.
it is beginning to affect your brain,
Mm-hmm.
and the brain shrinks, and the incidence of dementia is increasing. Foods, complex carbohydrate containing foods that also has salt, you have a double whammy.
Yeah.
The salt makes it shrink, but glucose is a very reactive molecule. It gets attached to different proteins in the body. One of the tests, you heard of the test, hemoglobin A1C, right?
Yeah.
Do you know what that is?
I'm assuming it's checking the amount of hemoglobin in your red blood cells, right?
The amount of hemoglobin with attached glucose.
Yeah.
Okay? Now, that is called what is called glycation. That's different from incorporation of glucose molecule into the structure. But this glycation can happen to the proteins, not only hemoglobin, other proteins are also affected similarly. If there is too much glucose in the cerebrospinal fluid, it can get into the nerve cells and get attached to the nerve, the fibers inside the nerve cell. These fibers are used for transportation of information. If you want to recall something from memory, a message has to be sent through the fiber. Fiber is constructed with a protein to which the glucose is attached. That link that produces the amyloid plaque.
Mm-hmm.
And when that connection is lost, you cannot transport information. You cannot get your memory. You cannot remember
Yeah.
what you have already stored, and you have dementia.
Mm-hmm. Yeah. I appreciate that explanation. And again, the common theme that's coming up here is our choices make a huge impact in terms of our health, and some of these very prominent issues we're experiencing in general amongst people are based on these diet choices, as you've highlighted. And unfortunately, it's all around us, right? It's easily accessible. So it requires additional diligence and conscious awareness on our side to make sure we're aware of what we're consuming. You've touched on processed foods, you've touched on grains. It requires a lot of effort because, to your point, it's accessible everywhere in everything, right? Especially if you're going out to eat, that's all you're getting. So it requires you to make that effort of perhaps even preparing your meals at home. Now, the other piece I was interested in understanding is what role does stress and fear play in diabetes, obesity, cancer, heart attacks?
Stress plays a role in our everyday life.
Yeah.
On the one hand, you need stress to survive.
Yes. The right amount.
If, if you are stress and your action, your life itself depends on stress. So stress is a normal, natural phenomenon.
Hmm.
What is different is how do you respond to it? If you take a Dalai Lama or Desmond Tutu, who have gone through so much stress, the things that cause stress, irritant, an inconvenience, an injury, an infection, all these cause stress. Or a relationship issue, they get anxious, they get depressed. Why? The trigger is the same, but the response is different.
Correct.
So, what is it that causes the stress response? And then the coping mechanism if that is eating.
Yes.
Why does that happen? We have to analyze if you are hungry,
Hmm.
when you eat, it gives you enjoyment, it
Hmm.
gives you satisfaction. Why? Because when you are hungry, the brain cells need glucose, that is their primary source of energy.
Hmm.
When the glucose level goes down around the cell, it creates a sensation of hunger. And for you to act, it releases the stress hormones, adrenaline and cortisol. Stressed out, you are more hungry, and you eat something, it makes you feel good.
Hmm.
You establish a connection between eating and mitigating your stress level.
Yeah.
So you become addicted to or habituated to eating to control stress.
Hmm.
And then you take one step further because food gives you enjoyment. Now you start into a habit of eating just to experience the enjoyment.
Yes. Yeah. So a few threads I want to tie here. So you're talking about the stress response, and you see a lot of people in fight or flight. So essentially, what I've come to appreciate and understand is the regulating our nervous system. And if we don't, because you gave some examples of people like Desmond Tutu and the Dalai Lama who continue to express stress, but somehow they're able to come across as grounded and regulated. So they're obviously doing something with their nervous system or managing their breathing, whatever that case may be. So that's first the stress response. The second piece, which I think is almost you're stacking on top of not only how you're dealing with stress, but now you're adding the food consumption on top, which is also an adverse response to the stress to begin with. Now you're getting, as you said, these dopamine spikes that you tend to get addicted to, and it acts as a form of escape rather than realizing what's this feeling I have that I need to sit with and understand. Is
Right.
that a fair?
Yes, yes, you got it very right and you explained it very clearly. Yes.
We're in again, we talked about the food available to us and how processed food and high in sugar is just at our fingertips. There's this other component of society where we're constantly inundated with information that's threatening, that induces fear, which again perpetuates this issue around our stress response. You talked about a stress response is very important for our ability to, especially our ancestors, it allowed them to survive and evolve. But now, in the world we live in, a lot of these threats are self induced. So, what are your thoughts around that?
That is another excellent question because I thought about it for a while and I came up with the book Your Health is at Risk to explain disinformation, misinformation, and missing information. Disinformation is when somebody who has a vested interest take the information and twist it and present it to the followers, and the followers just swallow it without any question. Misinformation is somebody in good faith accidentally misinterpreted the data, the facts, but then some people found that interpretation was beneficial to them and then continued with that even when they knew that was not right. The best example of these two are the first one is the COVID. Many governments used COVID to do what they wanted to accomplish. And misinformation. The best example is type 2 diabetes. Now, may I tell you how this came about?
Yes, absolutely.
100 years ago, children, almost all diabetics were type 1 diabetes. because their pancreas did not produce insulin. And as I mentioned in the opening, if insulin is not there to tell to ring the doorbell to tell the cell glucose is outside, glucose may accumulate outside, but the cell will starve inside for lack of energy, and these children used to die by age 10. So, two researchers in Canada
Hmm.
discovered insulin and the doctor who treated the maximum number of type 1 diabetic children is Elliot Jocelyn of Boston. There's a Jocelyn clinic in his name to honor him. He was so amazed that these children receiving insulin daily lived a normal life.
Hmm.
Their lifespan improved, quality of life improved. So he instructed nurses to go out into the community and give insulin to anybody with high blood sugar.
Hmm.
His own aunt came one day and said, "My blood sugar is high." So he injected her with insulin, and sure enough, her blood sugar went down. He thought it's the same disease happening at an older age. He called it adult onset diabetes because there was no test available to measure insulin. When that test became available, endocrinologists had a big problem because the patient has enough insulin and high blood sugar. So how do you reconcile that? So they called it non-insulin dependent diabetes. Now, if that's the case, that's a separate disease.
Yeah.
Then in order to get approval for that, for insurance money, they have to show this is an independent disease, what is the cause? And they could not connect it. So they changed the name to type 1 and type 2. In other words, they piggybacked the type 2 on type 1.
Hmm.
So the insurance companies and CPT code makers will not question it. Oh, this is a variation of the same thing.
Mm.
When in fact, type 1, as I explained, is underutilization of glucose because the cells don't know. Whereas type 2 is oversupply. As we explained regarding the meals,
Yes.
you are already full and you are refusing to eat more. Are you resisting? No, you are. It all depends on semantics, right?
Correct.
So endocrinologists were so smart and helped by pharmaceutical companies and glucose monitor device manufacturers. They just popularized the theme. It is insulin resistance, got it into the medical textbooks, so it is all over the world. Force the government to pay for whatever they do in the name of type 2 diabetes. So this is how it came about.
Hmm.
All you have to do is to look at the number of people suffering heart attack, stroke, Alzheimer's, kidney damage, vision damage, amputations, in spite of keeping blood sugar within normal limits with insulin. My own colleagues,
Hmm.
who was a pediatrician, he will come and when we invite him, look around the table and say, "John, I have to go and take extra sort of insulin." I said, "Why?" "Oh, tomorrow the food looks so good, I'm going to eat more, but tomorrow I want to keep my blood sugar normal." Instead of reducing the intake, he took insulin so
Hmm.
that the number, right? By the way, if you look at the announcements or advertisements on the TV regarding diabetic medications, they will all say it will keep the A1C below 7 or normal.
Yeah.
They will not say it will prevent the complication.
Hmm.
Why are we so dependent on a number
Mm.
but not the effect in the
Right.
long term? There are no studies showing you control blood sugar with insulin, you can avoid long term complications of diabetes. None. You know how that came about?
No.
Because remember, I talked about the nurses Dr. Jocelyn
Hmm.
instructed. When they went to the community, they found different children have different exercise levels, different needs for food. So you cannot give the same dose to everybody. So they asked, how much should I, how do we regulate the insulin dosage? So he went back, looked at his record. He kept very meticulous records. And he said, give enough to keep their blood sugar normal.
Hmm.
And endocrinologist just took that practice guideline and applied it to type 2 diabetics without long term controlled studies showing benefits, term research.
Hmm.
They also acknowledge that if you change your behavior regarding diet and reduce your total energy intake, and then you can avoid even the need for insulin.
Mm.
But they cannot do that. They just manipulated the evidence and say, oh, the cell is at fault.
Mm. Right.
And then they coined the other term, type 2 diabetes is a progressive disease. Every disease is going to progress if you don't do the right treatment, right?
Mm-hmm. Yeah.
But they don't want to look at that part.
Yeah.
That is what bothers me the most.
Hmm.
It may not, everybody may not follow a dietary change, but at least those who can, you are saving their kidneys, their eyesight, their brains, their heart, their legs. But the person has to ask questions.
Hmm.
And if the doctor says, oh, your body has become resistant to one of 50 natural hormones in the body, the first question should be, why? Is there any other example of any other hormones being resisted by the cells? Can you think of any?
No.
None.
No.
Why did the body pick on insulin?
But it's not supposed to be that way, right? To your point, it's the way they're manipulating the information. Yeah.
That is the only way, only explanation,
Hmm.
because endocrinologists don't have an explanation why one morning the body says, I don't want insulin, I don't like insulin. That is illogical. And if we have 200 types of cell, only three decide that way.
Yeah.
That is totally illogical. And they don't know what the mechanism is. Is it the doorbell not ringing? Is the signal not going? Is the control center not working? Or the transport module not moving?
Mm-hmm.
Nobody knows. And in every scientific category, before a hypothesis is accepted, you have to have an independent measuring mechanism
Correct.
that other researchers can
Yes.
verify.
Yeah. That's the reliability and validity of your testing
Right.
mechanism.
But there is no test for insulin resistance. So how can anybody else validate it?
Yeah. Yeah.
It is amazing that they are continuing, they are just making everybody believe that it is an accepted concept.
Hmm.
It's a proven concept.
Right.
It is not. The facts are there, but it does not prove
Hmm.
the explanation. The explanation does not prove the facts unless you have a solid mechanism and measurement.
Hmm. No, and I appreciate that. Now, there's talk of type 3 diabetes as well in the medicine world. So, what are your thoughts around that? And are you able to shed some light on that?
Okay, can you explain to me what area is this type 3 diabetes applied?
I'm not sure. I've just heard of it.
Okay,
Yeah.
there are some people who think Alzheimer's is type 3 diabetes.
Okay.
The real type 3 diabetes is when the insulin release mechanism, release the amount of insulin released in the body is lower. And that usually happens when you have a surgical removal of part of your pancreas.
Mm.
So if surgically remove it, and if you consume the same amount of food as before, there is not enough insulin coming out.
Right.
But initially, the immediate impact will be your blood sugar level will be higher than normal, and it will stay higher than normal longer period of time. So that is to me type 3.
Hmm.
The other one, they are trying to make up to justify use of insulin.
Hmm. Hmm. Yeah. Yeah. Now, we've talked about the dietary influences on the diabetes side of things. What about, there's often talk of it also being hereditary or genetic based. So, what are your thoughts on that? Is there any truth to that? Or can we, through our choices, dietary choices, can influence whether or not we're susceptible to diabetes?
Okay. When you say hereditary, you are talking about in regards to diabetes,
Yeah.
right? Okay. There is no uh, type 2. Let us talk about type 2
Yeah.
diabetes. There is no gene that's responsible for type 2 diabetes. Nobody has identified a gene.
Yeah.
So the hereditary part is not genetic. By the way, genes just give you the potential.
Correct.
It is not your destiny.
Exactly.
Okay. So that's it. Now, but at the same time, type 2 diabetics in families,
Hmm.
in family members. So it is familial, but not genetic. There's a distinction. So, what is happening in the family that everybody is exposed to? The food habits that you start in childhood, that is going to, you are going to keep it for the rest of your life. Now, even in the same family, one family member may develop type 2 diabetes, another may develop heart attack. What is the difference? There are two
Hmm.
variabilities here, variation. The factors here. One is we went on to the second. We asked earlier that what happens to the blood sugar.
Yes.
It should be, if you check it 4 hours after your meal, it is high. The next morning, it is back to normal. Where did the sugar go?
It's consumed, right, by the cells.
I'm sorry?
By the cells, it was consumed.
By the cells.
Yeah.
Yes. And if there is excess,
Hmm.
what happens to that?
Oh, it gets converted to energy.
At night, you're sleeping. It's not converted to energy,
Okay.
but it is converted to long term storage.
Okay.
And what's the form of long term storage? Fat.
Yeah.
So after 4 hours after your meal, all the nutrients are absorbed. Within the next 4 hours, all the cells have picked up what they need. The leftover will come back to the liver, and insulin will tell the liver, okay, this is excess. And our only long term storage factor is fat. This is how we store it. There is not any increase in the way you can store glycogen, which is glucose. So fat is the ultimate storage. Suppose you have two refrigerators, one 10 cubic feet, the other 20.
Hmm.
Every week you go buy the same volume of groceries. Which one will get filled up faster?
The 10
The
cubic.
10
Yeah.
parents.
Right.
So if you have only 10 pounds of storage capacity, but if we keep eating the same volume and fill it up, the leftover, the fat, will stay in the blood.
Hmm.
If you take any type 2 diabetic and go through their blood test, you will see an increasing levels of triglyceride, that is the fat, going up weeks, months, years before they became diabetic. So when the fat level goes up, the liver sends us there is too much fat in the blood because it's the fat that can block arteries. So the liver will stop converting the glucose into fat. It will dump the glucose into
Yeah.
the blood sugar goes up, and what do you have? When the blood sugar goes up, what do you call that person?
Diabetic.
Diabetic. So the diabetes comes from the inherited fat storage capacity. If we can keep that empty, you're not going to be a diabetic. But if you fill it, you become diabetic, regardless of your age,
Hmm.
regardless of your activity, regardless of how you look outside. There's a cosmetic obesity and medical obesity. 80% of the people who become diabetic in the developed countries are obese. 60% of the people who are diabetic in India are not obese because traditionally, for thousands of years, yeah, in India, they are lean, but that doesn't stop them from having diabetes. They can fill up. The best example is a young lady who is 8 weeks pregnant, and she is diagnosed with gestational diabetes. No previous history of diabetes, no family history of diabetes. How can that happen? Because when she's pregnant, her friends are telling her, eat, this is good for the baby's brain, good for the baby's height, complexion, skin, this and that. And she eats and eats, fills up her fat storage capacity. The glucose stays in the blood. And by the way, most of the food she eats will be grain based. Each complex carbohydrate in the grain have 200,000 molecules of glucose,
Hmm.
or up to. So her blood sugar goes up. She's become a gestational diabetic. But guess what? 3 days, 4 days after delivery, when she loses weight, her diabetes disappears. Why? Now she has emptied out her fat storage capacity. So that is just a simple thing.
Yeah. Yeah. No, I thank you for sharing that and walking us through it. Very much appreciated. The other piece I want to, as we come to a close here, you and I have chatted about was, and especially you coming from India originally, there's a lot of focus now on Eastern medicine, and in India, especially Ayurvedic, there's a, a different approach in comparison to Western medicine. What are your thoughts around Eastern medicine? And some of the stuff you've shared with me is really about the observational aspect of it, and perhaps not so much as being reactive, whereas Western medicine tends to be more reactive. So just want to get your thoughts on that. Yeah.
The Eastern medicine is primarily, if you want to give a general opinion, is preventive, how to prevent. So they observed the people who have illnesses and say what is the difference between those who have and those who don't. So they had detailed observational data. The deficiency is there are no comparative studies to show evidence because you can have association. Association need not be causation. So it depends on the observer. There is a lot of observer bias. Unless you do a controlled study, which takes time, that is what is lacking in Eastern medicine. But in the modern day, the Western medicine has gone so much dependent on medication. The doctor has no time to talk to the patient to really understand what the patient is suffering or the thinking of the patient, because the average science knowledge of the average person in the Western world is about 6 to 8 grade level. Medical science has gone up so much. There is a gap between the science knowledge of the person and that of the scientist. So people who take advantage of that, they fill the gap with disinformation, misinformation, and missing information. And the patient has to believe somebody. So you have so many information pieces coming in the social media, or you trust somebody and whatever that person says is the truth. You don't have the capacity to think independently.
Hmm.
So that is affecting both the Eastern medicine and Western medicine.
Hmm. Hmm.
In every country, there are people who are experts in local health matters. And those who trust, they only go to these people, regardless of what the outcome is.
Hmm. Yeah. No,
So that is in nutshell.
yeah, I appreciate it. So, last question here, and I think we've already touched on it in different forms, but if this is a issue, whether again, circling back, cancer, type 2 diabetes, obesity, a lot of the Western medicine, the solutions we have, or whatever prescriptions we have, is a huge multi-million dollar industry from a pharmacological perspective. Why, and again, I may be answering the question here, but I want to get your thoughts. Why are we not focusing on the simplest thing here, which is our dietary choices?
Measure this, and if it is this level, you're fine. How you achieve it in the long term, you're not allowed to ask, you're not allowed to think. If you ask a question, if the doctor thinks you are questioning his knowledge, how do you feel comfortable asking? And you need the doctor or the physician for your care of different aspects of your life. So you are afraid to question. That is why I started saying individually you are afraid to ask question when it comes to type 2 diabetes. But collectively, if family members, if friends, if you are a dialysis patient, if you go to the dialysis unit, meet others, start talking to them. Find out what did they do. Did they take insulin? Did they keep A1C normal? Did they still suffer the complications?
Mm-hmm.
Why? As a class, as a group, they can take action.
Yeah. No. Thank you so much, Dr. John, for all of this. I really appreciate all the knowledge you've imparted on us today, and the wisdom you've shared. And I can definitely, and I'm sure the listeners can also pick up on how passionate you are about this. So, very much appreciated. Now, you mentioned your books here. What are some ways listeners can find your work, whether it's online or find your book? What are some ways they can do that?
Well, everybody can go to drjohnonhealth.com. That lists all the books and Amazon.
Hmm.
You can order them. So that's the way to do it.
Okay.
So all the listeners, I'm just giving them my opinion. They should not take it at face value. They should check it out, make sure it makes sense to them, and then act on it once they get the information. It is not enough knowing. There are best example is the glucose monitor manufacturers. If you look at the advertisement, say, "Oh, you check the number and you can reduce your blood sugar." It doesn't happen that way. You need action, not awareness. So that is, you have to start thinking. If I take a medicine, yes, I can get a number. Is that control? If you control your blood sugar, you're not controlling your diabetes. You're controlling only a symptom, not the root cause. Anyway, I thank you for having me, and you are very knowledgeable in the way you are asking questions. You know your subject, and through people like you, I want to reach as many people as possible and start ask them to take charge of their own life. They have to be in charge.
Yes.
They cannot depend on a doctor or a medication. Yes, they need it. They need the doctors, they need the medications, but they need to know what these medications supposed to do.
Yes, I agree. And thank you very much for that. And I think so. That's my goal, is to allow people to not only recognize that a lot of this is within our span of control, and all we have to do is ask the right questions. Sometimes, if things don't feel right, we should be able to listen to our intuition and follow that as well. But yeah, and we're at a very interesting time where we have access to so much information, which can be a blessing and a curse. But it's important to seek out that knowledge and understand, because at the end of the day, it's our body.
Yes,
and we need to know what feels best and make choices
exactly.
accordingly.
I 100% agree.
Yeah. Thank you again. I really appreciate your time and I really enjoyed this conversation.
Thank you, Mr. Parker.